Let's get right into it, because there's this very specific moment most of us totally recognize, but we almost never take it seriously. You know the one. You stand up from your desk after a really long meeting, and your knees make an audible cracking sound. At Westminster Multispecialty Clinic, what we see with our patients every single day is that these little, completely ignored experiences, they're actually the beginning of a much larger conversation your body is trying to have with you. Just think about it for a second. Did your knees click or pop today? Maybe you stepped off a curb over near Dubai Mall and felt this brief, sharp twinge that disappeared almost as quickly as it showed up. Or, maybe you felt a deep ache and stiffness after a long drive down Sheikh Zayed Road. In our incredibly fast-paced Dubai lifestyle, a little knee discomfort feels like a completely normal price to pay for staying active. You kind of just file it away, right? You keep moving. But here's the thing. Your knees are absolutely not subtle when something is off. Section 1. The unseen workload. Most people really don't think about their knees until something actually goes wrong. But from a clinical perspective, the knee is this complex, load-bearing marvel. Just this simple, everyday act of walking puts roughly 1.5 times your body weight through each knee. Every single step, it's absorbing force, stabilizing your entire body, and carrying the full weight of everything above it. To put that into perspective, that is a massive daily burden on a relatively small joint. And honestly, that load escalates rapidly. Add a flight of stairs to the mix, and boom, that load doubles to twice your body weight. And if you're out there playing dynamic sports like padel, which, as we know, is incredibly popular here, with all those quick lateral cuts, sudden stops, and repeated jumps, you are pushing that load even higher. Section 2. Why knees start complaining. Over time, if your alignment is off or your muscles are weak, the joint is going to start speaking up. At our clinic, we routinely see two completely distinct patient profiles that end up with very similar knee issues. On one side, we've got the desk worker. Prolonged sitting literally shortens your hip flexors and weakens your quadriceps, both of which are absolutely crucial for how the knee tracks and handles weight. On the flip side, we have the active athlete. They're dealing with padel or gym injuries, or just gradual overuse from training hard without enough recovery. When either of these folks heads out for an ambitious weekend run at Suffolk Park without the right joint support, well, the knee just ends up absorbing mechanical forces it simply wasn't prepared for. And this right here leads us to cartilage wear. We're seeing early arthritis and joint pain show up in people much, much younger than you'd expect. The really crucial thing to understand is that cartilage wear doesn't make some dramatic, noisy entrance. It's a slow burn. It builds quietly over years of suboptimal movement, maybe some old injuries, and repetitive strain. It's basically the slow degradation of your joint's natural cushioning, kind of like the gradual wear on a tire's tread. We also have to talk about the internal scaffolding, the ACL and the meniscus. Think of these guys as the shock absorbers and stabilizers of your knee. When they get compromised, whether that's from one sudden awkward landing at the gym or just slow building stress over time, the whole joint feels it. The rest of the knee is suddenly forced to absorb forces it was never ever designed to handle on its own. Section 3. Signals you should not ignore. So how do you actually tell the difference between standard muscle fatigue and real joint distress? Well, first up on our clinic's list of red flags is lingering swelling. If you get some puffiness around the knee after a jog along Jumeirah Beach Road and it just doesn't go away within a day or two, that's a crystal clear signal. It usually points to underlying inflammation or fluid buildup that really needs a proper clinical assessment, not just a bag of frozen peas. Next up is pain that actually changes your gait. If you catch yourself favoring one leg or maybe quietly avoiding certain movements, your body is compensating. And look, compensation is dangerous because it acts like a domino effect. It creates entirely new structural problems somewhere else in your body. Then there's the feeling of locking or catching. Have you ever felt like your knee is just sticking or like it's flat out refusing to straighten out fully? This is a highly specific mechanical issue, and it very often points to a meniscus tear or flap. But the good news here is that this specific mechanical problem responds so much better when we catch it and treat it early. Now, pain at rest, that is a totally different ballgame and a major red flag. If you've got discomfort that actually wakes you up in the middle of the night, or it stays with you even when you're sitting perfectly still at your desk, you're not just dealing with exercise fatigue. That warrants a prompt medical evaluation to figure out exactly what is actively inflamed in there. And finally, instability. That terrible feeling that your knee might just give way, especially when you're walking down a flight of stairs or navigating some uneven ground. This sensation of the knee buckling is very often tied to ligament involvement. It's a clear mechanical failure warning, and you should never just brush off. Section 4. The true cost of waiting. You know, a lot of people think, hey, if the pain isn't bad enough to completely stop me, it's not bad enough to deal with right now. But clinically speaking, that's a huge risk. At Westminster Multispecialty Clinic, we always remind our patients the knee doesn't exist in a vacuum. It's part of a kinetic chain. An unstable knee changes how you walk, which instantly puts unnatural stress on the hip above it and the ankle below it. Secondary issues start popping up. Recovery timelines stretch out. What could have been a super straightforward fix suddenly turns into something way more involved and disruptive to your daily life. Section 5. What good care looks like. So what's the alternative? How do we fix this? At Westminster Multispecialty Clinic, our whole approach is built on a structured, progressive philosophy. We call it a least invasive first model of care. It always starts with a thorough clinical assessment to figure out what's driving the symptoms. From there, we typically move to rehab and physiotherapy. If we need a bit more support, we look at guided injections or PRP. And finally, for actual structural damage, we utilize arthroscopic surgery. Let's break those down real quick. For a lot of our folks, rehabilitation is the absolute foundation, a total game changer. And I want to be super clear here. Rehab isn't just sitting around resting. It is structured, progressive work. By actively strengthening your quadriceps, hamstrings, and glutes, we directly reduce the mechanical load that the knee joint itself has to carry. We see this completely resolve pain that patients have been dealing with for months. Now, for others, we might step it up to guided injections or PRP, which stands for platelet-rich plasma therapy. This is a brilliant, highly targeted way to tackle deep inflammation and biologically support your body's own healing process. It's honestly an excellent option for patients who want to maintain their active lifestyle while we actively treat the underlying condition. But look, sometimes there is clear structural damage present, like a complex ligament tear. In those cases, surgical options really are the most effective path forward. Our orthopedic specialists right here in Dubai are incredibly experienced in minimally invasive arthroscopic procedures. They are experts across the entire spectrum of knee care, from conservative management straight through to complex reconstruction. You're in great hands. The main thing I really want you to take away from this explainer is this. Getting assessed is so straightforward. In our team's experience, just finally getting an answer, understanding what is mechanically happening inside your joint, goes such a long way toward easing all that worry and anxiety that builds up around unexplained pain. So, if you've been carrying this knee discomfort around, telling yourself you'll look into it eventually, consider this your friendly clinical nudge. Come see your team at Westminster Multispecialty Clinic in Dubai Healthcare City. We're an unhurried team. We actually take the time to sit and listen, and we really want to help you while the window for a straightforward, easy treatment is still wide open. Reach out, book that consultation. I'll leave you with this final thought for today. Your body relies on an absolutely brilliant, complex mechanical system to keep you moving through your busy life. But just like any complex system, it requires a little maintenance. Your knees are talking, so are you listening?